Let's speak to Mario Ottiglio, who's a global health policy consultant. Mario joins us from Geneva. Welcome to the program, Mario. First of all, is the WHO, in your opinion, doing a good job in managing this crisis and coordinating some sort of international response?
Yeah, no, absolutely. WHO within the UN system is the agency that is tasked to directing international health, coordinating public response. They are doing an incredible job with the resources that they have. WHO is notoriously short resources, as you know. It's working with scientists across the globe on at least 20 vaccines and other solutions, and that is happening really probably 2 or 3 months only after the pandemic started. But they're also acting as detectives, right? They send teams around the world, try to understand how the disease is spreading, what are the patterns, and actually they are sharing information as much as they can with countries. It's a critical player right now. We cannot do actually without WHO.
I don't know how the person who actually came up with the information came about translating the money that the United States gives the WHO, but the analysis from this person was that a lot of that money goes towards measles and polio vaccinations, the money that the United States gives. So how dangerous, apart from COVID-19, is the fact that the Americans are not going to be making their major contribution to the organization?
Well, listen, the WHO is in dire need of reforms when it comes to the budget. Of course, I'm not a spokesperson for WHO, but what I know is that at least 80% of the total contribution of WHO is actually voluntary. So that means that it's not assessed contribution. That means that that 80% of voluntary funding can be directed only to programs that are dependent on the funder willingness. So definitely cutting money, and the US is the largest contributor. I think it's about 400 million or so. Cutting money to WHO, especially in the assessed contribution, means that WHO will have less money to work on COVID. And WHO is the last line on defense, I think, when it comes to countries in Africa, in Southeast Asia, for instance. So you can see the impact there.
Yeah, tell us about that impact, especially in the developing countries. I mean, the Middle East and Africa, they are very much behind the curve. Started in China and then spread to Europe and now in the United States. What's going to happen in those parts of the world now with the money? And actually, is the money going to make an immediate difference, or is it something that the US has already promised that it has to pay, and then Trump's decision will mean that in a few months there'll be less money?
So I think that would be a good question for colleagues in the U.S. Looking at whether Treasury is holding those funds. My understanding is that some of the funding is still is not departed. So definitely that is likely to have an impact. But looking at I think at the big picture here. The big problem that we have that we need to face is that this is a moment where halting the funding to WHO is really not a good idea, and that doesn't regard only the U.S. If any world leaders come with that type of statement and idea, it's quite dangerous. In the very words of Bill Gates, the world needs WHO now more than ever.
Mario, thank you so much for your time. Really appreciate it. Mario Ottiglio in Geneva.